Well, welcome to the View from the Inside podcast, episode number 14. I'm Kevin Richardson, president of Tactical Wealth Management and the host of the View from the Inside podcast. It's the month of August. We're getting ready to get football season underway, but one of the things that we've been hearing a lot from our clients over the last year or so is they've had a lot of questions about Medicare, and we're by no stretch are we experts on Medicare. So that's why I thought it would be fun to bring in an expert on Medicare. And by the way, I kind of did the work to understand why I had so many clients asking the question. Well, we've got 11,400 people per day in the U.S. that are turning 65. So to do the quick math, right, that's 342,000 people a month. And that's 4.1 million people per year. So a lot of people hitting age 65 and jumping into Medicare. So I go find myself an expert, none other than Dan Wilkins. He's a senior account executive at Brent Eastman Insurance. They do group health insurance from their Salinas office. They're really good at what they do, and Dan happens to be the expert. But Dan, more importantly, welcome to the View from the Inside podcast. I got to ask, have you been on a podcast before?
Thanks, Kevin. It's great to be here. No, I don't think I've ever been on a podcast before. First time for me.
Right on. We'll make it easy for you, that's for sure. But we always do the origin story with our guests because it's fun to hear everyone's life story, if you will. How'd you end up in Salinas, and how'd you end up working at Brent Eastman Insurance?
Gosh, well, it's a great story, and I'm so happy to be here. I've been here at Brent Eastman Insurance for about 10 years now. Brent and I both got our foundation in insurance doing group agricultural health insurance. Okay. And we've done it kind of on different sides of the street until we came together. I worked for an outfit called Western Growers Association, and they have a wonderful tailored product for agricultural employers. And at that time, I dabbled in some Medicare supplement, but my focus was group health benefits. And eventually, Brent and I, as Brent likes to say, we ate a lot of the same dust. We were knocking on the same doors. We were competing for business. And eventually, we thought it would be wise and fun to join forces. So he brought me into the firm about 10 years ago. And my role I've had different roles, but my role is starting to change to be an expert, or to be kind of the helper in things that don't fit our group health insurance model. So that's when, for instance, a dependent is turning age 26 and they no longer qualify as a dependent. Or when someone steps out of a business role and now has more needs that are more on an individual basis. So how can we help those people? And one of the biggest things that's come our way is so many people, as you said, turning 65 and having a whole new slate of options. So I've jumped into that to see what we can do to service and assist those people.
Well, and so on a higher level, I know you guys are really good at what you do, and I'm a fan of the work that you guys do with your group health insurance. And one of the things that you pointed out to me when we had gone to lunch is a lot of times you'll have someone who's employed that turns 65, and sometimes there's some options in terms of coordinating with Medicare that makes it maybe better for the employee and better for the employer. And that's some stuff that's kind of how you get your toe in the water, if you will.
Right. Correct. And I think it's important to emphasize what you said, Kevin, that these are options that employees all of a sudden have some new options available to them. When they turn 65, they're not required to step out of the employer-sponsored health plan, but they have an option that might decrease their cost and increase their coverage. And that's kind of a win-win for the employee and for the employer. The employer oftentimes will participate in this with the employee to say, hey, you don't have to leave our plan, but if you do, we'll be happy to compensate you for these costs because they are so much less than the group health expenses we're facing.
Interesting. Well, we'll get into those details, and I want to make sure I do the disclaimer on this. The opinions voiced in the podcast are general information only, not intended to provide specific advice or recommendations to any individual. And to determine what strategies, investments, and insurance policies may be suitable for you, consult the appropriate qualified professional prior to making a decision. So want to talk about this stuff on a real high level and then go find that specific advice. Go find Dan Wilkins, if you will, or Brent Eastman. But, you know, you're kind of hitting on a thing that we always feel like as a financial advisor, people come to us for advice on money management. I've got a rollover 401k. What should I do? And then they make a decision to bring it to us. And with that, we'll start to give them advice on how to actually handle the investments. But what I realize after doing this 25 plus years is we're helping clients make a lot of decisions that you only make one time in your life, whether that's when to start Social Security, when to retire, right? Do I have enough money to retire? You know, required minimum distributions when you get ready to do those. These are all things that you do once. And for me, I think that Social Security decision and the decision on what you do with Medicare, those are the big ones and where you really need that professional advice. So I was thinking it'd be great. Let's paint just that real basic picture. And I would say probably 80-90% of the time it doesn't roll out this way. But let's take an individual that turns 65, because people always have that number in their head. Hey, that's when I'm going to retire. Realistically, people usually go a little bit longer than that in some capacity. But let's take an individual that's turning 65. I had a client ask me the other day, they were in their early 60s. They're like, how will I know to enroll in Medicare? That was, I thought, the great first question. They can expect to get something in the mail from Social Security / Medicare, correct?
Correct. And they'll also get just a bombardment of mail from all kinds of insurance plans and people like me, even though
Right.
it's kind of frowned on for us to send things unsolicited. We're as insurance professionals, we're required to get everybody's permission to talk with them about Medicare Supplement so that there's a reduction in misinformation that gets communicated to these beneficiaries. But yes,
Okay.
The very first step is for people to reach out to Social Security within about a 3-month window of turning 65.
Okay.
And when you, as we kind of walk along this pathway of Medicare, Kevin, there's some wonderful guarantees, but there's some important timetables. There's important timing that has to be done. And so as long as we are in the right time frames, everything happens so smoothly and with guaranteed acceptance, which means an insurance company can't refuse or can't price you higher than their standard pricing. Guaranteed acceptance, no pre-existing conditions, no health questions asked. So really, when we do things in the right timing, everything goes so smoothly. And the very, very first issue of timing is making sure that you apply for Medicare within 3 months of your 65th birthday. That can be the 3 months before, the month of, or the 3 months after your 65th birthday. And all you have to do is somehow contact Medicare, somehow contact Social Security and say, hello, I'm Dan Wilkins. I'm turning 65. I want to sign up for Medicare. And
Right.
they will.
Okay.
Okay.
So if you're an October birthday like me,
Right.
you'll get something in the mail, and you've basically got from July before I turned 65 through January after I turned 65 to make sure you enroll. And I think I read somewhere if you're already enrolled in Social Security, meaning you're taking distributions from Social Security,
Right.
then the enrollment in Medicare is automatic at age 65.
Correct.
Okay.
And for many of us, Kevin, we grew up in an era where enrollment in Medicare was pretty much automatic no matter who you were. Now that's not the same today. You need to enroll in Medicare. You need to let them know that you're turning 65, and then you're going to have an interesting choice right away, because if I'm in this window right now and I call Social Security right now, or I go online, somebody's going to call me back and they're going to say, "Great, Dan,
what do you want?
What do you want? You want Part A?" And I say, "Yeah, I guess." And they're going to say, "Do you want Part B?" And I need to be educated enough to know that Part A is hospitalization. Those are hospitalization benefits, and those are free. So
Okay.
almost everyone would want to sign up for Medicare Part A as they're turning 65. It's a no-brainer. It's a great deal. Part B comes with a monthly premium. Part B is everything that's not hospitalization, pretty much. It's outpatient services, ambulance, lab stuff, all that kind of
doctor visits included there too on Part B, correct?
Outpatient physical therapy, things like that. Part B is not free. Part B comes with a monthly premium of roughly, this year it's around $185 a month. That's a standard premium, but it gets even better because if you're what Medicare calls a high income family or person, then there is an additional premium that you're asked to pay. So Part B is a little more nuanced decision, Kevin. You know, it's not like automatic, oh yeah, I'll take Part A and Part B. Well, I need to think about my situation with regard to my health insurance. Am I going to continue working? Would I like to continue on my employer's plan? In that case, I may not need Part B right away.
I see. Okay.
I could get Part B at a later date if I want. If I'm set to retire, if I want to get my health insurance into a place where I can retire, then maybe I do want Part B, and I want to go down this road of Medicare and its accompanying products. So Part A is a yes, and Part B is nuanced to my situation.
Right. And then you brought up the great point. This coverage is guaranteed. You don't have to take a physical, fill out a medical questionnaire. Okay. So that's Part A, Part B. And if we go, there's Part C and Part D. I want to jump ahead to Part D.
Okay.
And then we'll come back to C, if you will.
Sure.
Part D, that covers medications. And part of the reason I think we've got a lot of retirees, right? There's a lot of medications flying around. Everybody's living longer. But Part D is medication coverage. Now, is that offered by Medicare, or is that is provided by outside insurance companies?
That is provided by outside insurance companies. Part D, Part D it's a the very first thing that we learn and that we that we need to remember about Part D is that there's a big change in how you've had your benefits for most of your whole working career. For most of your whole working career, you've been on an employer-sponsored health plan, and it's got medical and prescription drugs all together integrated in one plan.
Makes sense.
When we embrace Medicare and the Medicare accompanying products, one of the first things that happens is that medical and prescription drugs are separated into separate policies, a whole separate thing. So you can have your Medicare and if you choose a Medicare supplement, or if you choose a Medicare Advantage plan, you can have that on one side, but you have to deal with your prescription drug plan. You have to think about that sometimes separately, especially when you're on a Medicare supplement plan. You have to get a Part D plan, a special plan, and these are available. These are widely available, and they can be kind of confusing, but you have to get a Medicare Part D plan. So the very first thing is to remember that these are now separate. They used to be together. I just thought health insurance always included a prescription drug plan. Well, no, it doesn't, right?
Right. Okay.
So that's
okay, perfect. Okay, so part A, hospital stays. Part B, doctor visits, and a fixed price depending on what your income is when you retire. And then Part D is medication, aka prescription. So bring it all together for us with Part C. What is that?
Okay. All right. Part C is a special kind of plan called a Medicare Advantage plan. And we like to think of these as kind of a health maintenance organization, an HMO style plan.
Right.
Medicare Advantage plans are plans where I'm going to sign up with a carrier, and I'm going to choose from their list of doctors a primary care physician. I'm going to be very, very, very careful that all my care and consultation starts with that primary care physician, and that together we quarterback my healthcare through their systems, through their provider network, through their hospital network, through all of their things, knowing that if I go out and arrange care on my own with any other provider, it will likely not be a covered thing. So a great example of a Medicare Advantage plan are our friends who have Kaiser coverage. Kaiser is a wonderful organization up and down California, lots of hospitals. As you might know, they are more concentrated in urban areas. And this is true of Medicare Advantage plans. They can be a very, very attractive option when we are in an urban setting. Now, for me, and in the population that I serve, which is mostly Monterey County, we're not in a big urban area. So Medicare Advantage plans in our area, there's only one. It's called Aspire Health Plan. Very, very good, strong community plan. They have a very high satisfaction level with the people that have them. But again, the trade that we have to make as a person that enrolls in their plan is to say, I'm going to sign up with my primary care doctor, and together we're going to use whatever resources Aspire has, and we're going to navigate that way, as opposed to a Medicare supplement plan, which has a freedom of choice component. And if I wanted to go find the doctor that fixed Joe Montana's knee, to fix my knee, I can
Right.
do that. I can go find that guy, and I can
Right.
say, "Hey, I saw how you fixed Joe up, and I've got the same issue." Or that's kind of a wild example,
Yeah.
but you have freedom of choice, to go and use. If I wanted to seek care at, let's say, the Anderson Medical Clinic in Houston, Texas, or if the Mayo Clinic, or UCSF, or Stanford, or anything like that, I can go and do that, and I don't have to go through a big referral process to get that done.
Okay. So we've established the age that you start. We've gone through the A, B, C, and D and created some clarity around that. Now, a couple of what ifs. I know I hear this one all the time and it kind of makes me chuckle, but your Part B premium is determined by your income. And so I'll have people say, well, gosh, what if I stop working at my 64th birthday and then don't make any money the year before I go on Medicare? That won't work, correct?
Correct. The income is going to the way the income is looked at. It's the Medicare looks back 2 years ago on your income taxes.
Okay.
So they're going to go pull. They're going to see Daniel Wilkins applying, and they're going to say, "Let's see, Dan wants coverage in 2025. So let's pull up Dan's tax return for 2023, and let's find that income line, and then we'll see, where does Dan fall, and so what happens to Dan's Part B premium." And every year they will do that same search. So
Okay.
my income might go down. Let's just say if I retire from work, and my income goes down. But what happens if I have a big capital gain,
Hmm.
and it's going to hit my taxes? Well, is that going to make my Medicare Part B premium go up? Well, the answer is not right away, but there might be a year, there probably will be a year, depending on how my tax return comes, where that thing has an influence on my
Okay.
Part B premium, a 1 year influence on my Part
Okay.
B premium. That
Okay.
comes up a lot.
Okay. Okay. Yeah. What was that called? That's the income related monthly adjusted amount, right? I
Right.
pulled that off the internet just to
Yes.
be impressive for you on
Thank
today's
you. That's very
podcast, right?
good. Very good.
Yeah. Okay.
Very good.
So,
And
so
by the way, Kevin, that applies not only to Part B, as in boy, but the income related monthly adjustment amount also applies to Part D, the prescription drug plan. So,
okay.
so sometimes people are surprised when they get a bill from Medicare that has something in that box as well. They say, "Wait a second." You said, "Yes, that is correct. It applies to both Part B and Part D."
Okay. Okay.
Okay.
Perfect. Okay. And then staying with this age 65 thing. So,
Yeah.
Part A is free, hospital stays.
Right.
So, no reason to not sign up for that.
Right.
But let's say that you retired at 65 and you decided, I guess, you were going to live dangerous and not enroll in Part B. Can you defer Part B? You say, well, gosh, I'm a healthy guy. I'm only going to enroll when I start to have health issues. How does that work?
Gosh, you're kind of playing with fire there, because without the interesting thing about Part A and Part B, and what creates a need for additional coverage, is this. Part A, it's wonderful to have hospitalization coverage, but Part A covers roughly 80% of what happens to you. All
Okay.
right. So 80% is nice. If the bill
Okay.
is $500, then
Right.
$400, great. I have $100 I can pay. But if the bill is $500,000, or if the
Right.
bill is $5 million, 80% is not enough coverage. Part
Right.
B, by the way, also covers roughly 80%. But
Okay.
neither of these ever have a stop loss. So it's 80% forever, or it's there's no up to 5,000 or up to 5 million or up to any number. There's no
Okay.
stop loss. So this
Okay.
creates an open-ended exposure for people, and that's the gap that Medicare supplements, by the way, Medicare supplements, their proper national name is Medigap,
Okay.
because
Medigap, right? Okay.
they fill that gap of coverage, and they provide the coverage that gets you button tight, so that if you have a hospitalization, you've got your Medicare doing its part, you've got your Medicare supplement doing its part. And if you purchase the strongest, what I think is the strongest Medicare supplement, then your out of pocket for this whole event, let's say it's a hospitalization that lasted 5 days, maybe it's $1.5 million.
Okay.
Your out of pocket for that is $257.
Wow.
See,
Okay.
now that's good coverage. I mean, that's like,
Yeah.
whoa, that's pretty good. And
Right.
that's why people buy Medicare Part B and a Medicare supplement. And usually they buy a Medicare Part D prescription drug plan as well.
Perfect. Okay.
Does
So
that make
let's
sense?
change. Go ahead. I'm sorry.
Does that make sense?
That certainly does. Yeah, no, that answers that question. So let's change our scenario from being super simple. Someone turns 65 and they turn on Social Security and they enroll in Medicare. Let's say that someone is going to work until age 67, full retirement age for their Social
Right.
Security. They're in their 50s, let's say. So they're going to go till 67. So at 65, they're going to enroll in Part A because that's free.
Right.
That's a given. And then at that point, they have the option, if they're covered with their job, what they want to do is talk to their employer, talk to a professional like you, and understand, do I stay on the company health care? But all the while, you're going to be enrolled in Medicare Part A no matter
Right.
what, correct?
Right. Correct.
Right. Okay. And then make the best decision on who's going to pay for the doctor visits and your medication / prescription drugs. And it could be your employer. It could be dropping your employer's coverage and buying your own Medicare out in the open market, because remembering that advantage is the fact that you don't have to do a doctor's exam. You don't have any of these prerequisites around that Medicare coverage. So it could go either way at that point. It really depends on what your employer plan looks like and what kind of coverage you're looking for, correct?
Correct. And there's one more variable that's very important that you and I have to think about, and that is if a person has a dependent. They may have a spouse, and in
Great
particular,
point.
a spouse who is younger. If I have a spouse who is younger and that spouse is covered on my group health plan from work,
Right.
then we have a little more to think about before I go off and say, okay, I'm going to take Medicare Part B and I'm going to go down and buy me a Medicare supplement and a Part D plan, and man, I'm going to have this all buttoned up. But what about my spouse? That person
Right.
now is 62 or 60 or 61 or something like that. So sometimes that's always an important consideration. I had a telephone call this morning that came in from a friend that is grappling with this decision, and retired. They both retired early, but now the spouse is looking for individual insurance, as the spouse is working
Wow.
toward age
Yeah.
65. right? So
Right.
that's an important thing that we have to make sure that we're putting in the mix of this to see if this decision is making the best sense for everyone.
Makes total sense. Right. Okay. And
Right.
then I've been doing these disclaimers, but Dan Wilkins of Brent Eastman Insurance, not affiliated or endorsed by LPL Financial or Tactical Wealth Management. But I want to throw that in when I kind of asked this question, because I thought it was really neat hearing this story from you in terms of what you guys do with group healthcare. And if anybody listening to the podcast is looking for group healthcare, but I thought it was really cool. You were saying you actually look at the employee rosters with the people you provide group healthcare for, and literally are looking for people that are going to be 65 and
Right.
Medicare eligible, and go in and look at what is the best scenario for this employee and the employer, correct? I mean, that's pretty cool if somebody's running a business and they've got a group healthcare plan and you guys are doing that work for them.
Yes, correct. And the way that we like to approach it, Kevin, is we just like to be a source of information, so
Yeah.
that employees, as they are approaching 65, they're getting contacted about Medicare. They're getting told all these conflicting things. It can be very, very confusing.
Right.
All this alphabet soup of A and B and D and C and G and all that stuff. And what is this all about? And what are my real options? So we like to say, if you're thinking about this, if this is on your mind,
Right.
we'd love to help you understand, what the real issues are and how it all works, and see if it works for you. Knowing that, you're not required to drop the employer plan. You could stay on it as long as you want, but
Right.
there might be some advantages, and you might be thinking about retirement. You might be wondering, how am I going to deal with health insurance in a year from now or 2 years from now when I'm ready to quit work? Will I qualify for Part B? Will I be able to just hop off of my employer plan? And the answer to
Right.
that is if you delay enrollment in Part B because you're still working, you have an opportunity to enroll in Part B anytime after you turn 65, but it takes about 2 months for
Okay.
Medicare to figure out that you're doing all this and to get all the computers lined up and everything. So there has to be some lead time to help you do this smoothly, so that
Right.
so that once you make this thing, you've got your new plan information, you've got your new ID cards, you're ready on the day that you make this transition. So we have to have a little pre-planning, but when we have it and we do everything in the right timing, like I said, it's guaranteed issue. There's no pre-existing, there's no health questions. It's very, very, very smooth.
No gaps in coverage, right?
No gaps
That's
in
what you
coverage.
guys are looking for.
No gaps in coverage. Yes.
Well, I tell you, Dan, anytime I have an insurance professional on or buy them lunch to kind of pick their brain, I'm amazed at the detail around the work that you guys do. It's super impressive, and insurance is always one of those things. I know when I talk to clients, it's like, you don't really want to dive into it because there's a lot of details and it costs
Right.
some money. But boy, I'm always impressed when I listen to somebody like yourself talk about what you guys do and what you do for your clients. Do me a favor. Can you give everybody your phone number and maybe your email/website in case they want to reach out and get a hold of you folks at Brent Eastman Insurance?
Sure, absolutely, absolutely. You can reach me at area code 831-917-1665. That's how you contact me. My email address. My email address is pretty complicated. Dan at BrentEastman.com. Dan at BrentEastman.com. And if you want to contact Brent, who is fantastic, you can contact him at Brent BrentEastman.com. See how easy that is? It's really cool. And our website is BrentEastman.com, which is a cool place to see a bunch of things about what you can do with us, what kinds of services we have.
Well, perfect. And as you said, you and Brent have eaten a lot of dust over the years, but I tell you, there's not a lot of dust eating going on right now. You guys are definitely pros, and I appreciate your time. I appreciate your knowledge for our client base and for the listeners of our podcast. And just thanks a ton for being on.
Well, thank you. Thank you very much for the opportunity to come on, Kevin. Now I can say I've been on a podcast.
We got it done. You can check that off. That's right on. Well, again, thanks to Dan Wilkins. Thank you for tuning in. Best thing you can do for us, give us a follow, share the podcast. If you got a financial question, give us a buzz, 831-717-1144, or our email, a little tougher than Brent and Dan's, but it's krichardson@tacwealth.com. On behalf of Dan and our producer, Bill Tucker, and the good people at Proudmouth, thanks for tuning in, and so long until next time.
Thank you for listening to the View from the Inside podcast with Kevin Richardson. Click the follow button to be notified when new episodes become available. To ask questions about topics covered during the show, head over to www.tacwealth.com. And don't forget to check the show notes for additional contact information. Kevin Richardson is a registered representative with and securities offered through LPL Financial, member FINRA SIPC. The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision.